This is a special edition of Morning After powered by Forward DFW together with the Dallas Morning News. And thank you for joining us, everyone. I'm Ron Corning. We are continuing to work with Forward DFW together with the Dallas Morning News to bring you the very latest on the coronavirus pandemic that is washing across the United States. And we're hoping to sort of start off with some good news here in terms of what we've learned about this virus that will allow us to manage it better. But there's no overlooking the bad news, and that is that there is so much uncertainty around this, and it's still having such an impact on our lives, on our health, on our economy. For example, the mayor of New York saying just yesterday that he doesn't believe New York has the capacity to handle the number of people who may become sick. We're talking about the capacity of hospitals, and then that lends itself to our own lives here. Will we be struck by it in the same way? Do we have what we need in order to manage it as people get sick? How contagious is the virus? What are we learning about that? There are more young people becoming more ill from this than first thought. Remember, initially they had said the elderly were more susceptible to becoming ill and more susceptible to dying from it. That may not necessarily be the case. We have one of the leading experts joining us here coming up in just a moment, Dr. David Winter from Baylor, Scott & White Health, to answer some of your questions as well. We are live here on Facebook for the moment, and so we want you to begin interacting and asking your questions. This is, as we said, a special edition of Morning After, in addition to being our special coverage with the Dallas Morning News and Forward DFW. Yolanda Williams is my co-host, and for the sake of social distancing, following protocol, she's joining us via Zoom. Yolanda, good morning. Oh, can we hear you, Yolanda? She's going to unmute.
There we go.
There you go. This is the first time we've done this, so you are unmuted.
Yes, I'm unmuted. Good morning.
And you, like so many of us, have been really, in a way, unable to go about your daily life as you normally would. How are you holding up? A week ago, you said you hadn't quite gotten to the point where you feared this. I don't know if that's the right word, but how are you feeling?
You know what? I think concerned is more the word I would use. Right now, all my after-school programs have been canceled because, I work in education. So I'm having to be a little bit more creative now. We're putting something together where the students can engage with us online. So that is something that's in the process. So I'm hoping that works out.
All right, so stand by there, Yolanda, and as you have questions, we're going to bring you back in. But let's bring in Dr. David Winter from Baylor, Scott & White Health, because he is a calming voice in the midst of a storm. I hope that's not too heavy a burden to bear, but we are depending on you, and you have been so widely available, and we thank you for that, for sort of giving us some sense of optimism that we can work through this, but there are steps we need to take. And let's start with the good news. The good news headline today is
that people are getting over this virus. 84,000 people in the world have had it and are now virus-free. 100 in New York City are virus-free. In Wuhan, China, where this started, as the last 2 days, no new cases. So it is on the decline in some areas. It's still growing in others, but people do get over this virus.
So if we were to look at China and 2 consecutive days of no new cases reported, their first case was reported back on December 12th. So December, January, February, March. So just about 3 months and a week. So we're looking at maybe 13, 14 weeks for China. But they also had a surge in the number of cases in a shorter amount of time. That's that curve that we talk about flattening. Is it possible then that we'll have a high number of cases just over a longer period of time?
I think we could learn from China and also learn from Italy, where it's also on the incline right now. Actually, it's still going up there. That's a big concern. The deal with this virus, it's gone in most people's body. We win the war, we kill the virus in 14 days. The problem is this virus is so contagious. If you have it and you get well, how many people did you touch or come in contact with along the way that then are going to spread it to somebody else?
So that really is the extent of the good news, and the rest of it is about taking steps so that we can avoid even more bad news. And you believe that what we're doing here, that we're closing restaurants and bars and gyms, and apartment buildings are closing gyms, so we're trying to limit, we're forcing people to limit their contact with others, which is not to say we're doing enough. You don't believe we're doing enough to kill this virus in a short amount of time.
Well, the numbers show that. 1 month ago in Italy, folks were happy and free going to cafes, going to bars. The virus was there. They ignored the warnings, and now it's taken over the country. They're in total lockdown.
So, okay, if what we're doing right now is inconvenient, well, some people are complaining about what they're being forced to do, and they believe it's an overreaction. I don't believe that at all. In fact, I want to share with you, this is personal, but initially, a couple of weeks ago, I was in Mexico at a wedding. I heard about the cases in Seattle, and I wasn't shocked that there were a number of people who died in one location, the elderly at a nursing home. My mom having been in a nursing home, I understand how contagions can spread within a nursing home environment. And I thought to myself, okay, this is like Legionnaire's disease on a cruise ship. It's a contained place. The virus is there. We know where it is. We know where it's contained. This is an overreaction. 30,000 people die from the flu. Why are we reacting to 12, 13, 14 deaths? Not to diminish the impact, of course, that has on families. I'm just saying by the numbers. Now I'm really concerned. In a matter of 10 days, I've gone from what is the deal with this? Why are we reacting this way to we need to do more? This is having a huge impact, not just on the economy, but people's emotional well-being as well.
So Baylor Scott and White Health, we track these in our entire system, which goes across the state. 5 days ago, we had 2 confirmed cases. Then the next day it went to 4, then to 16. Yesterday was 46. This curve is going up.
And the curve is going up in great part because we have come to the table with more testing. People can get testing more easily. It's more widely available. This is a guessing game, and I don't want to put you in a position to speculate. But this is just a matter of fact. The numbers that we see are only the numbers that are confirmed by testing. That's not to say there aren't many, many, many more cases, people out there who aren't even showing symptoms who have this, correct?
There are lots of folks who have it that don't know they have it. Maybe they have a minor cough, say it's my allergies. Some folks have no symptoms. Those are the carriers, and those folks can spread it to the folks that need to be protected from them.
So based on what we've seen in other countries, some estimates are saying as many as 90 million plus people could end up getting this virus, testing positive for it in the United States. New York is saying, I said at the top here, that Governor Cuomo is saying that their healthcare system, much like Italy's, does not have the capacity to be able to handle the number of cases they may receive, which is why now they are bringing in Navy hospital ships. That's happening in LA as well, and other port cities will have to call on them. How are you wrapping your head around the possibility of the worst case scenario as a doctor?
I think it's a real possibility. So we all need to take steps to prevent the spread of this virus. Again, our bodies can cure this virus. 99% cure rate. That means we win the war, we kill the virus if we get it. But along the way, this virus is so contagious, you're going to spread it to many other people. We need to assume that everyone has the virus.
Okay, so let's talk about what we're doing here. So we're in a position, and I'm going to get to Melissa in a moment. We're in a position here to inform people. That's what our jobs are. And we're doing it from this studio, and we're taking as many steps as possible. Based on your experience coming here today, based on how we greeted each other, based on the environment, are we doing the right things, or should we not be here at all?
Well, 6 feet across from each other, that's fine. Anything that you touch and I touch, I'm going to wash my hands or disinfect them, both work, before I touch my face. We all touch our face 200 times a day, I'm told. It's just automatic. As long as your hands are clean, that's okay. This germ, this virus stays on surfaces for a long period of time, up to 3 days in some instances. So you have to assume that anything that somebody else touched may have the virus on it. Just wash your hands and then stay 6 feet away so we don't get it spread by the air. If we do those 2 things, this virus will be stopped in its tracks.
My life has really come down to coming in here and taking the steps you're talking about. Melissa, I will say, takes all of these steps to protect us. Like, you are sort of the mama bear of
trying
meets military police of this
She wouldn't even give me a bottle of water.
I wouldn't. I said, what would you like
No.
to drink? And he said, water. I said, great, follow me and you can get it yourself. I said, and you can turn on the light and open the fridge.
Right.
Yeah.
And so I try to stay contained here. I know I realized only after the fact of, like, you touch your face, because I do this. I'm not going to do that anymore. Give me a sense of what people are saying online today.
Well, a lot of questions, and then I want to get to what you guys are doing to help with screening. But people are wanting to know if they kind of go through this process and they have it and they get over it, are they immune to getting it again?
Typically, that's true. There's one case we're told of overseas where a person had it, then got it again. But there's hundreds of thousands who have got it and then don't get it again. So we think that, yeah, that's your best chance is if you had the virus, you build up antibodies, so then you are immune.
But isn't that interesting that what you're saying is there's one case of, which means there could be more cases of, that falls into that realm of uncertainty of what we don't know, and that science is sort of trying to keep pace with the spread of the disease. When you talk about asymptomatic carriers, that's another big one. You said people who don't show symptoms can easily infect somebody else. This notion that young people are less susceptible to it doesn't seem to be bearing itself out by the numbers, and you have some of those numbers with you today.
Yeah, early on we thought young people were semi-immune. Not many of them got it. Kids don't get it at all, we were told. The recent studies show that of people who have the virus now, 20% are between the ages of 20 and 40. Of those in the hospital who have it, it's about 15% are between 20 and 40. And of those that are in the ICU, the sickest of the sick, 12% of those folks are young people.
Yeah, so we again, as this evolves and we learn more, we have to react accordingly. So this notion that it's this sector of the population, not this sector, throw that out the window, because as this is evolving and we're learning more, we know that that's just simply not true.
So what you're doing, you have a new app, a screening app.
Right.
And I want to show, if we can, Jason, these images. This is really important. Let's see, there we go. Okay, so basically you can go online, get this app, and go through this questionnaire, and then determine if you need to consult with a physician, and then you have some sort of testing.
Yes.
The drive-through.
Yes, we do have several drive-through stations right now to test you if you are referred. We don't want to be testing people who don't have any symptoms. We don't have enough test kits. In fact, I was at 2 clinics yesterday. They're getting low, and I worried about them a lot. Their morale is good. They look tired in their eyes, but their energy is up. They're glad to be doing a good service for the community. But we're running out of test kits. So my thought is that you ought to just assume everybody has it. Now, if you have some significant symptoms, we can test you. Go on the app, and if you answer the question to the positive, then you'll take an e-visit, some questions that you'll get electronically. And if you pass that screening, then we'll be glad to take you and do a test kit on you.
And how long does it take to get results? We're hearing mixed messages.
You know, it was really good at first. We were getting them back in half a day, but with the backlog, I heard yesterday it may take 2 or 3 days to get it back now. We've got some problems with testing. The testing is very important if you are extremely ill. Then we need to isolate you in a hospital. For everyone else, you're going to stay home anyway.
Which makes the point that it's really important that you do some of these self-screening steps that have been implemented by Baylor, Scott, and White Health, because you can rule yourself out, therefore allowing somebody who's more ill and more likely to have the virus to get the test.
Here's another point. So if you go and get a test kit and you're negative, that means you're negative today.
You may not be the second time around.
You may not be tomorrow because it's out there in the community right now.
Yeah, this
What,
is...
there's another question about remedies and taking ibuprofen.
Are there any over-the-counter...
Yeah, what can you do over the counter if you're having these aches and pains?
What we're doing to treat this, as we do with all viruses, is symptomatic treatment. If you've got a runny nose, you can take a decongestant, a nasal spray. If you have a cough, you can take cough medicine, acetaminophen, ibuprofen for aches and pains and fever. All that works. There is no specific treatment for the virus right now. There's no antiviral treatment that works. There's no antibiotic that works. Some of the really sick folks get a secondary bacterial pneumonia, so they may need treatment with antibiotics for that. But there's no treatment for this virus right now.
Yes, so I think that's a really good point. If you've got the flu, for example, we know it's a virus. You take acetaminophen, which is Tylenol for the aches and the pains. The virus doesn't go away. You're just mitigating the feelings of the symptoms so you can manage through it a little bit better. But you still have the virus. You're still contagious. All of those things apply to this. Melissa?
Another question about giving blood. So right now, obviously, we're living in a different world. Any recommendations?
Yeah, the Red Cross has really got a problem right now. This virus doesn't cause the need for blood, but we have the need for blood for other instances, for trauma cases, people that have bleeding issues, people that have bone marrow problems, can't make their own blood. Those folks need your blood, and right now we're seeing a decrease in donations, so we would ask the public to please go by the Red Cross and donate blood if you're healthy.
So and that was a question I had for you. This virus itself, again, doesn't cause a need for a blood transfusion for those patients who have it, but we tend to get so myopically focused on this crisis that then we're not taking the steps to donate, or we're not mindful of the needs of the blood banks. So then we now have a compounded problem that people who are ill with other things aren't able to get the treatment that they need. What about if you're donating blood and you don't know that you have coronavirus? Are they screening blood for that?
I don't know the answer to that, Ron. I would assume that they might want to screen for that, although we don't know that this disease is spread through the blood system.
We don't.
We don't know that right now. That hasn't been tested.
So there can be diseases that, because I would think that would be the most potent, most concentrated way in which a virus is transmitted. So there are some viruses that are transmitted via the air.
This virus goes to the
and not
lungs.
necessarily through the blood.
Yes, indeed. Most cold viruses are in your head, then may go to your lungs. This virus goes right to the lungs. It's got some affinity for the lung tissue. That's why you get this pneumonia symptoms. So if you have cough, shortness of breath, and fever, usually with a lot of fatigue, those are the signs of could be the sign of coronavirus. So you need to be tested if you have those symptoms. But just regular head congestion, a cold virus? No, not necessarily.
Okay, there's a tweet that's been going around. I don't know if you've seen it. We can pull it up also, Jason, about first responders and these doctors, physicians, nurses. And basically, you can see it right there.
My spouse is a physician in the emergency department and is actively treating coronavirus patients. We just made the difficult decision for him to isolate and move into our garage apartment for the foreseeable future as he continues to treat patients. There are a number of other tweets here that follow. They have 2 young children. They have an infant. They don't want them to be compromised. And that picture, Jason, you can go back to it because I think it really speaks to what we're dealing with here. We stay here for you, right? With love, our healthcare workers. Please stay home for us. So what our healthcare workers are asking of us is to take the sorts of steps that Dr. Winter is asking, and that is to isolate beyond what these mandated closures seem to have driven us to do, like really take specific steps and do it now. But frankly, everyone has to do it everywhere.
Yes.
Or this is not going to work.
Yes.
And what about firefighters? What about how are we supposed to stop all of them from working and having contact? And if there's an emergency, what do you do?
Indeed, and the policemen, and again, back to the healthcare workers, we worry a lot about them. We're running out of masks also, so that's a big concern. If this thing starts to go up even higher in this country, we're going to have a big problem with taking care of folks. If our healthcare workers get sick, that's a problem.
We have a question about the masks actually on social media. Is it true that the medical staff are now being told not to wear masks, and is it sending the wrong message?
No. It's interesting, this disease is spread through the air and then also by contact. And so if you have coronavirus, we want you to wear a mask if you get around anyone to stop the spread. The masks to prevent the droplets from coming in aren't ideal. They're not perfect. I mean, they have some barrier, but that's not a way to prevent getting coronavirus. Staying 6 feet away is probably better than wearing a mask and getting closer to people. So the masks aren't as important for folks who don't have the disease right now.
Some other questions that we've gotten from viewers, let's run down through them here quickly, Dr. Winter. Elective surgery, wait or go ahead?
No, anything that you don't have to do, I would recommend that you do not get that done right now.
That eye lift can wait, okay?
Our hospitals now are 86%. Yeah, that's a good point. Any kind of
Change
cosmetic
that
surgery,
appointment.
please, no.
You'll be good. Your face will still be there to be lifted later. I had a flu shot. Am I protected?
Not from coronavirus, no, not
Nope,
at all.
Not at all. We knew that, right? Social distancing, how to greet someone, we've covered that. Work environment, when I get home, should I disinfect? Let's just say that if someone can work remotely, they should be working remotely. I know of several companies where it would be possible for them to work remotely, and they're not yet. And I think that defies every bit of advice you've given, and I'm wondering
Totally
why
agree.
that's not happening.
Totally agree.
Do we have to have the government mandate that too?
It'd be nice if we mandated ourselves and
That's what I'm thinking.
thought about our neighbor, thought about our friends, thought about our parents and grandparents who are going to get it if we get it. So let's be careful with this.
It
now.
would be nice if what we did was take the advice of experts like Dr. Winter, who are tracking this, watching it, analyzing it, working with others from the CDC, the World Health Organization, to figure it out and listen to what they're saying. I'm deferring to you because, I feel like you are one of the most qualified and most caring people in this community to speak to this issue, and we're lucky to have you here in DFW, and I hope this Facebook live is being shared with people everywhere so they can get a sense of how you were approaching this, because I think it needs to be more widely followed. Immediately before I hug my kid, should I disinfect? I mean, we're isolated, but not everybody is alone. We're all cohabitating, many of us, with someone.
Correct.
How do we handle that?
I'm discouraging hugging. My kids,
Even among family members?
we're doing the elbow thing. You don't know if
Yeah.
that family member has got it from someone else. If they went to the grocery store, did they touch something that the COVID virus patient had? We don't know. So I think the biggest thing, this virus goes away in 15 days. So if we all stop spreading it, it would be gone. Our bodies can cure this themselves.
What about someone who's pregnant? I have a friend who's delivering tomorrow.
She should have that baby. Go ahead and deliver it.
Well, she's going to have the baby.
Try to hold it off
She's going to
another
hold
month.
off.
Cross your legs, girl.
Should she try to do this at home?
No. Our hospitals are set up to take care of folks. If you have coronavirus in our hospitals, you are in a quarantine wing of the hospital, so we're not transmitting it in the hospital. She should go and get the regular care. We're trying to free up more hospital beds, to Ron's point. No elective cases. If you're really sick, though, talk to your doctor. And let your doctor tell you if you need to come and get a test done, if you need to come in the hospital because you're ill for some other reason. Let the doctors help guide you with this. We're still doing business as usual, trying to put off the elective cases that can be delayed for a month or so.
Let's talk about this, because you mentioned hospital beds. I believe we have, correct me if I'm wrong here on the number, 1 million hospital beds nationwide.
You've heard that?
Well, if 90 million people become ill and then even 10% of them need hospital care, or let's even say 1%, we're starting to really play a numbers game here, which is why we're talking about Navy ships being brought into harbors. We're talking about the Army Corps of Engineers being on standby to build makeshift hospitals if needed. This is real life. This is not a hypothetical. This is not the movie Outbreak from the 90s. Like, we're living in a real situation here. I have to be honest with you, it feels a little bit like the Twilight Zone. I don't know if the reality of this, I'm taking it in, but I don't know if I fully processed and have come to terms with the fact that this is how we're living now.
Yeah, we all feel good. We look good. We may not know anybody who has coronavirus right now, but it's out there. The bed capacity in Italy is double what we have here in the United States, but it's not enough. They ran out of hospital beds. They're running out of ICUs. They're running out of respirators for folks.
Yes. There was some news, Gillian had shared it, and it comes by way of TMZ, which in this new age we live in has become a news source that is right more than it's wrong, that Elon Musk is willing to transform factories where he makes the Tesla into facilities to make respirators, possibly. Gillian, that came over this morning. We haven't confirmed that. I'm just saying that.
I think that came from me. She's
that
giving
come
you the look.
Gillian's giving me the
That
look.
is not from the Dallas Morning News.
Gillian, I want all unattributed information to come from you. Yeah.
Anything from TMZ comes from me.
Gillian will be unemployed tomorrow. No.
But don't you think, let me ask you something though. Okay, so while we laugh, isn't it important to have some laughter?
We have to.
We have to.
If you don't laugh, you'll cry. I mean, right?
And I really, if we can show this video, Ron set it up.
Okay, so we're talking about being isolated and being at home. So Brad Pritchett, who's been a fill-in host here on this show and has been in theater for many years, and he brings his theater skills and his social media savvy to bear in this video where he's giving you a life hack on how you can exercise with gym's clothes. Let's see if you'll try this one at home without ending up in the ER. Take a look.
Hello, social media. Me again, day 2 of our work remote, and I'm going to make you laugh because I don't like doing steps and I don't like running around the neighborhood. So I figured out how to hack it and do an at-home treadmill. I did see this online, so I'm not taking credit for it, but all you need is some soap, a little bit of salt, upside down, so sorry, I'm not good in the kitchen, clearly, and some sass. Soap, salt, and sass. Mix that up. Start walking. Now, if you're like me, you like to get going, get a little run with it. Do you have my feet? Camera guy? Okay. I already feel the calories burning, honey. Tune in tomorrow for my other hack. Bye.
I've already broken one knee. I don't need to break another one, but thanks for the tip.
He's so funny. He's doing every single day. I mean, yesterday was day 2, but I mean, my family, we are watching these videos of him because he is able to make a little bit of humor and create some humor during this time when we're all sitting here going, okay, now
Well,
what
we have to have some levity, right, Dr. Winter? I mean, I know you're in an environment where you deal with so much bad news on a daily basis that you have to find that. I want to know, you mentioned grocery stores. Albertsons has 2,200 plus stores across the country. They're going to block out hours on Tuesdays and Thursdays from 7 to 9 for those most at risk of catching coronavirus, or I should say those most at risk of suffering the most from it, that being the immunocompromised, the elderly among us, pregnant women, for example. They're going to cordon off the store just for them on 2 days, Tuesday and Thursday. So that's one step that a corporation is making. You go to the grocery store and you find yourself, it's like a Food Network challenge, like, oh, here are 4 ingredients. What can you make with this? I found out that pears, not very popular at the grocery store. It was like the last fruit there, that and kiwis. So I don't know if you have a recipe for kiwis and pears.
That was the salad you had 2 days ago.
That was the salad we had 2 days ago. I mean, really, this is a real life thing. And it's an inconvenience when we talk about these things, in my opinion, because somebody said earlier this week, just to give us context here, a friend of mine heard this from a friend of his who said, my grandparents were asked to defend an enemy of this country by going to war in Europe and putting their lives on the line, and many didn't come home. We're being asked to stay at home and socially isolate and be inconvenienced. Really, when you look at it in that way, that I think that's pretty good context, is it not?
I love that analogy because we need to be serious about this thing. It'll go on forever. It can go on for months, months, and months if we don't take steps to prevent the spread. This virus is very clever. It can spread. It has to spread. It will die. It knows that. If it's got a brain, I guess, but it knows it's got to spread. If we stop the spread, it will go away.
Any concern that it mutates as it changes hosts? We've seen that.
Always a concern about that. It hasn't done that yet. It's been out since December 12th as the index case when this started. We haven't seen it mutate yet, so maybe it's not a mutating type of virus. We hope not.
What are we learning from this for fear that this should come our way again in some other form with another virus that we've not heard of? Let's talk about where this originated in China. There are health conditions there, and I don't want to play this game of blaming one country over another because it could have just as easily started here or anywhere and spread around the globe. But there are certain health conditions and safety standards that don't exist, for example, in meat markets in China, that could have contributed to this. How do we get a handle on that? We are a global community. We have to make sure other countries are open to understanding that as they do trade with us and benefit economically, we also have to have each other's back, do we not, when it comes to science?
It's a very good question. We talk about penicillin being this huge innovation that saved mankind. No, it really wasn't in America penicillin. It was public health. We had public health measures that changed the way viruses and other diseases were spread back in those days. With this particular virus, they've traced this back to the bat coronavirus. So we think it came from bats in a market where the Journal of the American Medical Association said yesterday they were illegally selling meat from animals that were not supposed to be eaten. So we need to get those things changed.
And the H1N1 flu virus was sort of the mutation, or you know the terminology better than I do, or amalgamation of two viruses, one from pig, the other from chicken.
Came together.
That
right.
came together and then was able to be transmitted to humans.
Right.
And so we're not above reproach when it comes to how our food supply comes to the table and how animals are housed and where they're housed and those sorts of things. So again, this is not just one country's problem. It's happened to start this time in China, but could start anywhere, which is not to say that health standards everywhere shouldn't be improved when it comes to how we process meats and so forth. We have Yolanda back on the line. Yolanda, I know we lost you there for a second. You've been listening to this conversation. Anything strike you as we move forward and as we continue after listening to Dr. Winter?
Yes, I did want to ask Dr. Winter a question. Hi, Dr. Winter. This is my first time ever meeting you. I'm a big fan.
Hello there.
My father he's passed on, but he was a medical student at one time, and he taught biology and chemistry for over 35 years. And one of the things I remember him doing for us when we were children, we used to take a vitamin C mixture that he made from scratch. And this is something that we used to take on a daily basis every day before school. And I wanted to know your feelings about vitamin C and how important it is to keep it in our daily diet.
It's a very good question. And in fact, Linus Pauling, a Nobel Prize winner, made his second claim to fame by promoting vitamin C. He said it would prevent the common cold and prevent many other illnesses. We've tried now for 20 years to prove that, and we can't prove it. We don't think vitamin C is that necessary. We think that vitamins are very, very important, but you must get them from food. Fruits and vegetables is the best way to get vitamins. Our body's designed to get a small percentage of a vitamin out of a food source, and not a big concentration in one pill. In fact, when you do that, it can turn off vitamin absorption to other parts of the intestine. So vitamins are important. Fruits and vegetables are your very best way. If you can't have access to those, maybe a multivitamin, one a day might work. You don't need a lot of them, though.
All right. Well, what's in a pear? Is there anything in a pear that can help us? Because there was a run on produce at the grocery store, and that was the first thing to go. We talk about how we don't get enough fruits and vegetables. Well, for some reason, people decided they wanted everything at the grocery store. We want to thank Forward DFW for this week of broadcasting. We're going to have another day tomorrow on Friday where we're going to talk about a unique effort underway to mobilize volunteers, and that too comes with guidelines in terms of how you socialize with other volunteers. But we need to activate people, as we say, as Gillian says, your skill set, your superhero power. What is it that you have that you can give to someone else in need if you have idle time on your hands and really have no other option? For more information on that, you can go to FWD DFW.com. I want to thank Dr. David Winter from Baylor, Scott and White Health. Again, really a calming voice in the middle of a storm, taking us through this step by step. Really do appreciate you being here.
My pleasure.
And I'd like to say I hope we see you again, but really I hope this ends in such a way that we don't have to revisit this. My fear is that we will be talking
Amen.
more about this as this continues to evolve. Thank you all for watching. Thank you, Melissa and On Air Media, and we'll see you next time, everybody. Thanks to Forward DFW and Baylor, Scott and White Health, the Dallas Morning News is providing public health coverage of coronavirus free of charge. Go to dallasnews.com. Special thanks to Forward DFW's founding and supporting partners for making this coverage possible. Forward DFW was created in partnership with the Dallas Morning News. The goal? To connect companies, causes, and the community, and face issues that impact the economy and wellness of North Texas.